Hi everyone, welcome to our channel. And today we're going to answer the question, when should my child start brushing their teeth? Because it turns out that starting at the right time and knowing the right amounts of what to use and how to brush, all of these things matter. And in this video, we'll explain why. So let me ask you this. Would you agree that babies are born with bad breath? Well, they actually are. In fact, their mouths contain plenty of harmful bacteria. But don't worry, because even before any teeth come in, there are still steps that you can take to help keep those baby teeth healthy. And it starts with wiping your baby's gums twice a day with a soft, damp washcloth or gauze. This helps remove harmful bacteria and gets your baby used to having something in their mouth. When should a child start brushing their teeth? It starts before the very first tooth comes in. We recommend starting right away. So, for newborns, you can wipe their gums twice a day with a soft, damp washcloth or gauze. Now, once the first tooth does erupt, the American Academy of Pediatric Dentistry recommends using a soft, infant-sized smear of fluoride toothpaste, no bigger than a grain of rice. If you don't see any improvement, try changing the brand of toothpaste. Some brands are more abrasive than others and will make it easier for you to see the bacteria. Now, you may be thinking, but isn't it too early for fluoride? Well, according to the CDC, the benefits of fluoride start from the very first tooth. In fact, children who had fluoridated milk experienced significantly lower levels of tooth decay than children who did not. By the way, if you like this kind of evidence-based dental information, be sure to subscribe so you can be notified when new videos are released. Now, before we move on, I need to point out that babies put things in their mouths, so it's very important that you avoid any small objects around your baby. If you notice anything small lying around, please pick it up before your baby crawls over and puts it in their mouth. Okay, so now that we know that the very first tooth equals the very first toothbrush, what about after that? Well, there's an easy rule to know how much toothpaste to use for children under the age of 3. Just remember the rice rule. That means that the amount of toothpaste should be the size of a grain of rice. As your child gets older, between the ages of 3 and 6, the amount of toothpaste that they use should increase to a pea-sized amount. What about the actual technique of brushing? Who should brush a child's teeth, and when can children start brushing their teeth all by themselves? So, the American Dental Association recommends that children under the age of 7 or 8 years old receive assistance from a parent or guardian while they brush. Even kids older than that can still benefit from a little bit of extra help. Until then, parents, you must brush your child's teeth for them. However, you can let them practice first, and then you can follow up. The goal is to make sure that every surface of every tooth gets brushed. This includes the chewing surfaces, the inside surfaces, and the outside surfaces. It's also important to brush the gum line because that's where plaque likes to hide. Plaque is the sticky film that causes tooth decay. And what about those grooves on the back teeth called the molars? They can be pretty hard to clean, so be sure to pay special attention to those areas. Now, you may have heard that flossing is also good for kids. We recommend that you wait until the child has two teeth that touch each other so that you can slide the floss gently between them. How often should a child brush their teeth? The answer is twice a day for 2 minutes each time. While it might be easy to brush quickly, try to slow down and spend enough time to clean all of the surfaces of every tooth. One of the most important times to brush is right before going to bed. That's because saliva flow decreases while you sleep, which allows cavity-causing bacteria to thrive and produce acid overnight. So, brushing those teeth right before bed helps to remove the bacteria and prevent those cavities from forming. Okay, so how long should a child brush their teeth? 2 minutes, twice a day. But what about their first dental visit? When should that be? Here's the rule of thumb. Bring your child in within 6 months of the first tooth erupting or by their first birthday, whichever comes first. Now, the first visit is really important. It allows your child to become familiar with the dental office, and it allows the dentist to educate you, the parent, on how to best care for your child's teeth. It also allows the dentist to look inside the mouth and see if there are any cavities or other problems that need to be addressed. Establishing a dental home early is one of the most powerful tools for preventing cavities and helping your child grow up with a healthy smile. Here are some additional tips for parents. Be a good role model and let your child see you brushing your own teeth. Turn on the timer so you know when 2 minutes have passed. Make it fun with songs or apps. Positive reinforcement goes a long way with kids. Remember the rice rule and the pea rule when giving your child toothpaste. That means the size of a grain of rice for kids under the age of 3, and the size of a pea for children between the ages of 3 and 6 years old. Don't give your child a toothbrush with hard bristles. Instead, use a soft bristle toothbrush designed specifically for children. Now, I mentioned earlier that babies put things in their mouths. Well, milk and juice are no exception. But it turns out that milk and juice can cause severe cavities in baby teeth if left in a bottle and left in the mouth for too long. This is called baby bottle tooth decay, and it happens when the liquid sits on the teeth for too long. Bacteria in the mouth feed on the sugar in milk and juice, and then they excrete acids that destroy the enamel. The best way to prevent baby bottle tooth decay is to stop giving your child a bottle when they're done drinking. Another option is to switch from milk to water after the age of 1 year old. One last time, here are the key takeaways. Start brushing as soon as your baby is born. Use fluoride toothpaste the size of a grain of rice. Then increase to a pea-size amount between the ages of 3 and 6 years old. Make sure that every tooth gets brushed, including the chewing surfaces, inside surfaces, outside surfaces, and the gum line. It's also important to brush those grooves on the back teeth called the molars. Be sure to brush twice a day for 2 minutes. The most important time to brush is right before going to bed. Children should be under your supervision until around the age of 7 or 8 years old, until they can tie their own shoes. That's when they'll have the dexterity to brush all the surfaces of their teeth effectively. Children should visit the dentist within 6 months of the first tooth erupting or by their first birthday, whichever comes first. I hope this video was helpful and informative. Thanks for watching.